And now it's time to visit our friends at Li'inani Aesthetic Medicine. Hey everyone, we're here at Li'inani Aesthetic Medicine. I have Dr. Reed with me and aesthetic nurse Marie. Tell me a little bit about acne. How does acne begin?
So there are various theories about how it actually begins. We're all familiar with acne through adolescence. What happens in pre-adolescence is the hormone levels change in the body, and this results in increased production of a chemical called sebum, which is produced in the pores. But prior to that, and so you get a lot of the production of that, but you also, to initiate an acne breakout, the body overproduces another chemical called keratin in the entrance way to the pore. That keratin then, with the overproduction, clogs off the pore. The sebum production is greater, and so that can't get out anymore, and it's blocked off, and you get an increase in volume. This results in some inflammation. Quite often also there's a bacteria that's always on the skin. It's a part of our natural skin flora that can get into that sebum, and it just creates a wonderful place for it to grow. And so then you can get an infected form of acne. You get increase in this pocket of sebum, and ultimately, if it doesn't resolve on its own, that can burst open underneath the skin, and you end up with nodules, and that leads to nodular acne, and of course there's a lot of inflammation involved as well. So it's kind of complicated, and it's also not completely well understood every step, but we know that those are the major things that are happening with acne.
I mean, I find acne so annoying. Sometimes, just especially in social settings, it's just right there. And for me, I get it right on my T-zone. So I'm just like a little frustrated with it. What are some procedures that we can do to prevent acne or help acne?
Sure. Over here at Li'inani, we combine medical and aesthetic procedures. So Dr. Reed can prescribe topical or oral medications, and we find that if you combine that with aesthetic treatments, like probably monthly maintenance, either we do a chemical peel or microdermabrasion, and even for in cases that you have scars already, we do have laser skin resurfacing and also microneedling. So overall, we combine treatments just so we make patients happy, and hopefully they get the brighter and smoother complexion that they wanted.
So no matter what's going on with my face, you can customize procedures to get me to my goal.
Exactly, that's what we want. We always customize treatments, and we always take into consideration your medical history. So we don't just treat and give you your treatments. Dr. Reed will go through your medical history and get down to the root of the cause of your acne.
Fantastic.
It's also very important to treat the acne. I have noticed since coming to Hawaii that there's a lot of people with acne scars as adults, and that tends to indicate that they didn't treat their acne as adolescents, and I think that's a shame, because it can be treated in most cases, and that can avoid a lot of people are embarrassed about those scars. Now, we can do treatments for the scars themselves. We have aesthetic treatments for that, but it'd be nice to be able to head it off before that happens. So I think it's important, if you are having a problem with acne, have it dealt with, and that way we can avoid these kind of longer-term problems from it.
I think you bring up a great point. I think acne, everyone has acne. Everyone's gone through something with acne, right? But get educated and figure out what you can do to prevent it in the future.
And one important thing is never, ever squeeze your acne. Just go see a doctor.
Yes. Good.
I'm sorry, I'm so guilty. It's just right there. But you know what? Sign me up for one of your procedures. I'm ready. For more information, go to li'inani.com or call at 808-674-4300.